Hello everyone, we are from fourth group. At this time, our group will explain about amlodipine cardiovascular system. Before we start our presentation, I would like to introduce ourselves. My name is Jupal Majayara Adinsyaputi, and there are Yun Shweli, Joshua Michael, and the last one is Muselin Tripana. Definition of amlodipine. One of the drugs belonging to the class of calcium channel blockers is amlodipine. Amlodipine is used to treat various heart diseases, especially hypertension or high blood pressure, and angina pectoris or pain in the chest due to coronary heart disease. Amlodipine helps lower blood pressure and prevent angina by dilating blood vessels so that blood can flow more easily and the heart does not have to work as hard to pump blood. High blood pressure and coronary artery disease can be treated with a medication called amlodipine. This drug belongs to the dihydropyridine class, which are long-acting calcium channel blockers. Calcium channel blockers are drugs that include amlodipine. Amlodipine drugs work by relaxing the blood vessels, which facilitates blood flow. Amlodipine is also used to treat angina, a type of chest pain. And there are generic name and patent name. The generic name is amlodipine, and the patent name of amlodipine. There are Catersia, Norfax, and Norliqua. There are three dosages of amlodipine. The first one is 2.5 milligrams. The second one is 5 milligrams, and the third is 10 milligrams.
Now I will explain about drug class and classification about amlodipine. The first one is class therapy. This drug is a cardiovascular drug and the pharmacotherapeutic is a calcium channel blocker or dihydroridine, which inhibits voltage-gated calcium channels in cardiac and vascular smooth muscles. The clinical is for antihypertensive and the antianginal. Subclass therapy is for antihypertension and antihypertension systemic. The variant is single and oral drug. The drug interaction is alcohol, antihypertensive, beta blockers, diltiazem, fentanyl, lithium, and nitrates.
Now, I would like to share about the indication and contraindication of amlodipine. Indication of amlodipine included the patient with hypertension. Amlodipine is primarily prescribed for the management of hypertension. It is effective in lowering blood pressure and is often used as a first-line treatment due to its efficiency and safety profile. And the second one is angina. It is used for the systematic treatment of angina pectoris, including chronic stable angina and vasospastic angina. Amlodipine help by relaxing and widening blood vessels, thus improving blood flow to the heart muscle and reducing the workload on the heart. And the third one is coronary artery disease. Amlodipine can be used in patients with confirmed coronary artery disease to reduce the risk of hospitalization due to angina and also to prevent coronary revascularization procedures. And now moves to contraindications. Amlodipine is contraindicated in patients with severe hypotension. So, amlodipine is contraindicated in patients with severe hypotension, especially systolic blood pressure is less than 90 millimeter mercury due to the risk of exacerbating the condition. And the second one is cardiogenic shock. So the drug should not be used in patients experiencing cardiogenic shock where the heart is unable to supply sufficient blood to the body. And the third one is aortic stenosis. In patients with severe aortic stenosis, amlodipine is contraindicated as It may lead to further reduction in blood pressure and worsening the conditions. And the last one is no hypersensitivity. Patients who have shown hypersensitivity to amlodipine or other dihydropyridine should avoid this medication to prevent allergic reaction. Now, let's move to side effects. Like others medications, amlodipine also have potential side effects that need to be considered. So, common and significant side effects of amlodipine include, and the first one is edema. So, swelling of the ankle or feet, and this is one of the most frequently reported side effects occurring in a significant number of patients. And the next is dizziness and lightheadedness. These symptoms are common, especially when standing up quickly from a lying or sitting position, which can lead to fainting. And the third one is flexion, feeling of warmth and also redness. This can occur particularly in the face, neck, and upper chest. And the fourth one is heart-related issues. It is although less common, some patients may experience palpitation, fast or irregular heartbeat, and chest pain. So this is particularly concerning in individuals with severe heart condition. And the next one is gastrointestinal issues. It include nausea and abdominal pain and constipation can also occur. And the sixth one is liver problems. In rare cases, amlodipine can cause liver damage, indicated by symptoms like jaundice, dark urine, and loss of appetite. And the next one is gingival hyperplasia. It is swelling and tenderness of the gum, can develop soon after starting treatment with amlodipine. These are the side effects of amlodipine. Next is pharmacodynamic of amlodipine. So mechanism of action is inhibits calcium ion influx in vascular smooth muscle and also cardiac muscle. And it leads to vasodilation and decreased peripheral vascular resistance. The next is therapeutic effects of amlodipine. It can lower blood pressure and also reduces frequency and severity of angina attacks. And the next one is cardiovascular benefits. So, amlodipine can improve myocardial oxygen delivery and also it alleviates vasospastic angina by relaxing coronary arteries. Long-lasting effects and sustained action due to prolonged binding to calcium channels. So the patient outcome will be enhanced blood flow and reduces cardiac workload and beneficial for managing hypertension and chronic stable angina. So this is the pharmacodynamics of amlodipine. Now this is pharmacokinetic. Like other drugs, there are also pharmacokinetic included for stages, absorption, distribution, metabolism, and elimination. So in absorption, the amlodipine has high oral bioavailability, ranging from 60% to 80% due to its low absorption. Peak plasma concentrations are reached 6 to 12 hours after administration. Distribution of amlodipine. The drug has a large volume of distribution, 21 liters per kg, indicating extensive distribution into tissues. So it is approximately 93% bound to plasma proteins. And metabolism of amlodipine. Amlodipine is extensively metabolized in the liver via cytochrome P450 3A4 and the next it can be called also CYP3A4 enzymes. Its metabolites are inactive. And elimination of The drug the drug has a long elimination half-life of 30 to 50 hours, which supports one daily dosing. It is primarily excreted in urine, 60%, with the remainder excreted in feces. So these are all about the pharmacokinetic of amlodipine.
Okay, next is dosage and mode of administration. Amlodipine is a hypertensive therapy that can be used as a treatment for hypertensive patients. Dosage and mode of administration must be a good attention for the nurse. Hypertension usually occurs in women. Some factor that can affect the hypertension in women, such as for hormone, the cycles of menstruation, pregnancy, menopause, can affect the blood pressure. The second and third is lifestyle and stress. Stress can also make hypertension occurs in women because the activity of the adrenal glands that can increase the blood pressure high. Then, if we use the amlodipine, the first time or the first dosage they can use for us is 2.5 milligram. Then we can continue in 5 milligram, and the maximum dosage is 10 milligram. In case we forgot to drink amlodipine yesterday and today, we are not recommend are not allowed to double the dosage because some effect will be can be appear like hypotension, edema, heart disorder, and allergy. B. Mode of administration. Amlodipine is absorbed slowly to prevent a sudden drop in blood pressure. Amlodipine is well absorbed after oral administration. Blood concentration peaks after 6 to 12 hours, and its half-life is long, so once a day is enough. Next is nursing consideration. In general, the principle of applying the six right consists of right patient, right way, right time, right medicine, right documentation, and right dosage must be considered by the nurse. First, nurses are able to determine the planned goals and side effects. Second, nurses need to know dose and side effect, frequently interaction in drug administration. And the last you can see there is the third, fourth, and the fifth. So with the fifth point, that it is hoped that the quality of nursing care can be achieved because quality assurance is a part of the health service development program for the community. Okay, the last is pregnant safety index. This is needed to ensure the safety and efficacy of amlodipine in pregnant women. The use of amlodipine in patients with hypertension in pregnancy, conducted by the Smith et al. Also showed no increased risk of morbidity, health problems related to pregnancy and childbirth, and maternal or death, and fetal mortality in patients using amlodipine. So, when the pregnant woman using amlodipine, the pregnant woman also has to know the information about amlodipine, the medicine, the side effect, uh, the positive and negative effect for her and also for her fetus, and also the safety. Um, okay, so the effect to mom that using amlodipine because the amlodipine has a bad effect such as hypertension, edema, heart disorder, or maybe allergy that can bothering the um, growing of the fetus because in the first trimester that the phase or the time for the fetus to growing up. So if this happen, it will be bothering the growing time for the fetus. So amlodipine is recommended to use it in second and the third trimester. Because of that, the pregnant woman must have a good consultation with the doctor, and if the medicine, if the amlodipine has a good or has a right purpose, has a big purpose, is bigger than the side effect, it must be considered by the doctor, the nurse, the patient, the pregnant or the pregnant woman, and her family. So the pregnant woman will have a safety pregnancy.
So special application of these drugs is severe bradycardia, heart failure, or particularly in combination with blocker, cardiogenic shock, may impair ability to drive or operate machinery. Patient with hepatic disease. For pregnancy, safety in pregnancy is not established because that should discuss with the doctor. Surgery and general anesthetics. Amlodipine may interact with some general anesthetics using a fall in blood pressures. Infants and children are not recommended for using these drugs. That's all for our presentation. Thank you.